So let's recap this one. Dispatched to a local supermarket for an 88-year young male, injuries from a fall. So above 65, fall, already a cervical spine, seat collar concern for us. Patient was found in the cereal aisle by a store employee, probably the Cheerios section or grape nuts, two of my most favorite. So 88 years young, injuries from a fall where there's a bunch of individuals around. So let's get them fired up here on the monitor. Let's see. What do we got? So we got a heart rate of 80. Okay. So not tachycardic, but also could be on beta blockers. Pressure 105/68 with a map of 80. What's his normal, right? Is his normal 143/70? Then this is grossly hypotensive for him. Is his normal 88/60? Then this might be hypertensive for him. Let's come down here. Respiratory rate 16 and title's low at 32 though. Okay, so he's not over blowing down, but his heart rate's not out the roof compensating. Sat's okay at 98 with a low pleth. So he's got some constriction. Gobble up that 12 lead. What do we? Ooh. Okay, so let's see. Going here, a little ST depression in lead one, maybe some marginal here in AVL. Come over here to their friends. We see some in 5 and 6. So gonna be a little concerned with that circ, or that circumflex. Come over 2, 3 in AVF. Don't see any real changes there. So biphasic QRS and AVF. Axis is okay. Let's see, come down here, V1, V2, V3, V4, and V5 are all ST depressed. So either this is septa anterior ischemia, lacking oxygen, or this could be reciprocal changes to a posterior heart attack. So this person's circumflex, they would be left dominant, it's feeding the backside. If the backside has a blockage, it's flipping those changes. So the back, if we did a 15 lead, we would expect to see elevation. But the takeaway with this one is that 12 lead doesn't look at the full picture of your heart. And when you do a 12 lead, you should do a 15 lead, because what this can be, while it may be septa anterior ischemia, it might be a reciprocal change to a posterior MI, which is a much bigger, worse play, requiring pads, the aspirin, and the STEMI alert versus aspirin, fluid, and taking the patient up to the hospital to get checked. And remember, this person fell. So are they on blood thinners? What's their blood sugar? Is there any other symptoms they have? Lightheadedness? They're above age 65, so they have the atypical cardiac presentation. So which would be high on your differential list? Wouldn't say hyponatremia. The heart rate's good. QT looked good. QRS looked good. Brugada, they didn't have the different changes in V1, V2. Wellens. They didn't have the Wellens T waves. So go with A. What other tests do we run on? Definitely want to check that blood sugar. If you have iStats at the bedside, let's get a trope. So I'm going to go with and a 15 lead, right? You want to get that posterior look, rule in or rule out that posterior elevation for that STEMI alert. Uh, so we hope that helped. As always, if you have any questions, hit us up at info@lifelineemstraining.com, and we hope you have a great day.